So, welcome to Dr. Preeti's Care. So, let's start with our next topic, which is part two. How do we actually breathe? And so, it starts from here. Air moves into the nasal cavity and the oral cavity. Nasal cavity is the nose, and the oral cavity is the mouth. So, nasal cavity contains mucus and blood vessels. Mucus is very sticky. So, whenever air enters our nose, so the or some of the pollutants and dirt gets trapped inside the mucus. Okay, so and after the nasal, and so only the purified air goes into the lungs. And so after nasal cavity in the back of the throat, there is pharynx, larynx. Now pharynx is divided into three parts: one to nose, one to mouth, one to larynx. So to nose it is nasal pharynx, to mouth it is oropharynx, and to larynx it is laryngopharynx. Larynx is actually where our vocal cords are present. Then it leads to windpipe, which is trachea. Then it leads to both the lungs, leading to bronchi, leading to bronchioles, and then to alveoli. Alveoli is actually the air sac. This in the alveoli, actually the gas exchange takes place. So in the alveoli, more of the oxygen and less of the carbon dioxide is present, and in the bloodstream, more of the carbon dioxide and less of the oxygen is present. So here diffusion takes place. Diffusion means where movement of particles takes place from higher concentration to low concentration. So from the oxygen diffuses from the alveoli to the bloodstream, so we get good air, and from the bloodstream carbon dioxide diffuses into the alveoli, which we excrete out. So stay informed, stay healthy.